You see, 1 out of 4 people is apparently a drug user in Nagaland, which is really very high. We have been dealing with this problem for many years, but instead of, reducing the problem seems to be increasing. So definitely there is a need for some introspection, and this is one forum which provides an opportunity to introspect. Are the efforts that we are making sufficient? Is something more required to be done? Is there a problem in our coordination? Is there a problem in the sensitization and awareness campaigns that we are having? Are we able to take everybody on board in this fight against drug abuse? These are the questions that we need to answer. The high prevalence of narcotics and psychotropic substances in the state is a serious concern. As I said, we are making a lot of efforts, not only at the state level but even at the central level. As you all know, Nagaland is not a producer of drugs, but it is a transit point. A lot of drugs are coming maybe from Myanmar side and then from Manipur to Nagaland and then going into Assam and the rest of the country. And Nagaland is also a major consumption center. Many a time drug seizures are there. In Nagaland also, Manipur, Assam also. But are they making a serious impact? What fraction of the total drug trade are we able to catch? That is the question. We have been discussing with the Nagaland police also and various other agencies as to how best we can tackle this menace. My own understanding is that there may be small peddlers and there will be some kingpin, and I'm sure in every town or every locality there would be a kingpin. We should be able to catch these kingpins, at least some of them, and take some exemplary action so that it sends out a signal that we are serious about it. Apart from the enforcement and the legal action, criminal action that we need to take, you see, equally important is the sensitization part. As was very rightly mentioned by the secretary, that a peddler is a criminal, the user is a victim. And as a victim, we need to extend all help to him. Unfortunately, in our society, perhaps it is still a big stigma, and families and particularly the users themselves, they try to hide the fact that he or she is a drug user. The family also might be trying to hide because there is some stigma attached to it. So we need to get out of it. That is what all this awareness and sensitization is about. There should be no stigmatization attached to the victims or to their families. This is very important. It will perhaps help many of the drug users to come out openly, and then we can take some action, rehabilitation action, to bring them out of this drug abuse. The preventive action also is equally important, where all our the government agencies, the non-government agencies, the religious organizations, the churches, and every one of us, we need to really come together and create that awareness so that we can take preventive action. So friends, in my view, the time for planning has passed, and we are now in a time that calls for action, individually as well as collectively. We need to take eradication of drug abuse as a public movement, where each individual and each authority plays its parts with the fullest commitment.